best way to do this is to look at the index reaction, that is the most severe reaction we've had so far, to a reasonable ingestion. Now, of course, if you've got that infant who's been kissed by his parents and that's that only exposure, you can't make this judgment. But if you've had a child who's eaten at least a mouthful of something containing peanuts, you can then say that's going to be their worst reaction so far. Look at those symptoms. If they were mild, they just had some hives, if they just had some hives around their face or elsewhere on their body, then you can reassure them that that allergy is very, very likely to be mild. If they had that mouthful of peanut butter and started wheezing, went blue, their lips swelled up, and they needed adrenaline, well, we'd go to say that's severe. But we do recognise in clinical practice that not all peanut allergy is severe, and we can reassure many patients that it's mild. So for instance, in clinical practice, where we see most of our patients present is in infancy or toddlerhood, and almost all of those reactions of patients who present to our clinic are mild. So we're generally reassuring to patients. Test results don't predict severity. I'm just going to show you quickly some data. This is quite an old paper that we published almost 20 years ago now, and it's one of the first projects I did with Dr. Ewan in my unit. And we looked at the severity of reactions here, and these are clinical reactions. So 5 is life-threatening and 1 is very mild. And we looked at the skin prick test diameter for these patients in about 1,000 patients. And you can see there's no relationship at all. So patients with life-threatening reactions can have very small skin test wheals,